So, of course, you know that the conversation has been on. We hinted at this at the beginning of the program, that the PTF COVID-19 is saying that we need to take care. Because if we do not do the needful, the likelihood is that we'll go back to another lockdown. And the president has said,
not a lockdown.
You remember that, and the president has said the economy, Nigerian economy, cannot afford another lockdown. But with all of the things that you're seeing around, one is wondering, are we even disciplined? Do we even know what's at stake here?
So two things. You have a school of thought who are thinking that, look, well, I'm not sure if how to handle the second wave, even the first wave, they've not.
Oh, wait a minute, is it even real in the first place?
So those questions will exist.
Exactly, which is why, you know, it's necessary for us to continue to talk about it over and over again. And joining us, of course, a number of people may be aware that he has already put out word on this, is Ali Baba, who of course is a comedian and a businessman. Thank you for joining us this morning.
Yeah, right beside him there, you could see Dr. Jamiu Gani, public health physician, who is also in Bagada, Lagos. Well, Mr. Dr. Jamiu, perhaps we should start from your perspective about how all of these things are playing out, because, I mean, practitioners, so many people will meet you and talk to you about what is going on, how they're feeling. What impressions are you getting about where we are in terms of managing this protocol, the possibility of a second wave, and government's response to this?
Thank you very much for having me this morning. I think on the government part, I'm not being supportive. We've been trying to ensure that we develop all the necessary protocols to ensure that people comply. As well, government has tried to balance the response with the current economic challenge. But unfortunately, we are not being helped out by the behavior of the citizens, we in the community. I happened to be in a mechanic workshop yesterday. I remember we have over 50 people there. I was the only one wearing masks. Even when I tried to interview some of them why they not wearing masks, there were a lot of misconceptions. Some were even saying government has labeled malaria as COVID-19 and so on. So it's really challenging, and I think that if the cases continue to rise, there will not be any option that the government to kind of ensure there is a lockdown. Then my only advice is that we should learn from the first, learn lessons from the first wave, whereby it was a kind of a kind of top-bottom approach. I think before thinking of any lockdown, the government needs to engage all the major stakeholders, the road transport workers, the private sectors, all the relevant associations. Let them talk to them so that they can use this medium to talk to their own people on the need to comply with the non-pharmaceutical measures. And after I give them like a ample time, a period for them to make an adjustment, and if there is nothing a kind of encouraging, I think I will advise that the government, go into lockdown. And because going to lockdown now in this second wave is not an exclusion to Nigerian government, because it is currently a global trend. As you can see what is happening in UK, and you can see what is happening in America. So people are not really complying, and that is our major problem. But you wouldn't blame people anyway, because changing behavior is not an easy thing anyway. But I think we need to still continue to continue our risk communication, continue to sensitize our people to see that whether we can make a meaningful change as regards to this response. And
right,
at the same time,
let's have the opening comments of Ali Baba as well on this matter. Well, you have been talking, Ali, about this whole thing and how people are responding about it. And on the one hand is the Yuletide that's just ended, and then this events all over the place. And first of all, your take on how people are responding, and maybe you want to begin by sharing your own experience.
Well, I spent Christmas and New Year at the isolation center. I have been one of those who have taken serious precautions. I social distance. I wear my face mask. I sanitize. If you come to my office, your reading is taken, and you sit at a distance from my table if there's a meeting or anything. And as soon as I leave where there's a gathering, I always sanitize. And so I'm very, I stick to the COVID protocols. Beyond that, I'm also an ambassador of the NCDC. But how I got this, I do not know. But I suspect it was when I went to the village. My village people are after me. I said it was when I went to the village. But that said, it is it's not an experience I wish on anyone, except for those who said there's no COVID. I believe that the greatest problem we have right now is not of ignorance, it's of stupidity, because you cannot say you've not heard. And it was brought home even further to me like two days ago when someone called me, someone who has said that there's no COVID, called me to say his niece is going to the isolation center and needed me to give him a number to call. And I was like, number for what? He said, I said, I thought you said there's no COVID. He said, and so because between the time that I spoke with him and now, he said he has lost 3 people.
Wow.
So you can see that you do not need to wait to experience anything to learn. There are 3 ways you learn. Either you experience it yourself, or you see it happen to somebody, or you hear that it, or you read that it happened to somebody. We don't need to experience. You don't need to put your hand in fire to learn. And so all these medical people, all frontline workers that are putting their lives on the line, you trivialize their sacrifice when you go about like there's nothing, and you make it look like it's a propaganda, it's a hoax. It's so that is and I for one, I always organize a January 1st concert. Not organizing a January 1st concert economically, help me. So it is really very sad. Very sad.
Well,
that people do not.
let me quickly follow up on that, because perhaps, you may have heard this as well, and I think someone has alluded to, either of you has alluded to it this morning, the fact that some people compare COVID-19 to malaria, and that maybe it's because it's something that we can easily go to the shop to find medications to take care of it, and consequently it really shouldn't be much of a problem. How would you consider it to malaria? Would you compare it to malaria?
I think the traits are nearly similar. It's just a strain of it, the SARS strain, that is different. And that SARS strain is the problem. We were brought up with anti-malaria doses, vaccination, and all of that. So our immunity has been built up, because in Africa, malaria is a case. Overseas, malaria is not a case. And so a lot of us have taken chloroquine and vaccination and all of that stuff that has helped us up to a point. But you see, your immunity can only be boosted. It can reduce, but can be boosted. And so one of the things that is helping us in Africa right now is the fact that we have been dealing with malaria before. But this case that is happening right now there's a new strain of, because the symptoms may be close, but malaria doesn't have respiratory problems. When you start having respiratory problems, my brother, you have COVID. Don't be jumping up and down. You have COVID. And the thing is, just to be on the safe side, it is best to go quickly. Most people who are in denial and are doing self-medication at home, when it now gets to the point that your oxygen then drops below 90, where are you going to get a canister to get oxygen? You won't get oxygen. So go to the hospital. If you have the oxygen machine at home, fine. Continue to read your oxygen level, your SpO2. Your SpO2 drops up to 88, and you are telling me you are self-medicating at home. What is it? Holy Spirit that you want to be breathing in? Go to the hospital. Let them monitor you. When I got to the hospital, the doctor told me that I have to go straight on oxygen because I was at 93. 93, they put me on oxygen and kept me there for 8 bottles after about like 4 days. There are people who did 22 bottles, didn't survive. So when people tell you, oh, self-medicate, Dr. Gani will tell you, once you are not monitored by professionals, you have put your hands in your own hands. You are just said anything that happens, you take. Is it your house help that will come and administer oxygen or give you mouth to mouth? People just take these things for granted. And in the face of science, you should not be blind. Example that I give, I'm wearing medical glasses, I'm medicated glasses now. This is a vaccination to my eye. Whatever you do to be better is a vaccination. Just because this is physical. If you can't have a child, you do IVF. Whatever you do that will make you survive is a vaccination. So let's not trivialize medical. These guys are even sacrificing their lives to even treat us. People are resigning. Okay, maybe doctor will tell you. People are resigning. People are withdrawing their wives and family members from working in COVID centers because doctors are dying while they are giving people services, while they are helping people to survive. More doctors are getting infected and they are dying.
All right, Dr. Gani. Okay, let's bring in Dr. Gani. I mean, the messaging, the risk communication, which you did talk about. Well, the challenge you have here is that, for instance, those groups of people that you met, how they responded. Several people, you have people like that who are responding that way. How should we be modifying the messaging? I mean, you interface with several people on a regular basis. There are those who are suggesting that shouldn't we equally be telling people, well, look, while you try and protect yourself and do what you can, you equally need to do something about your immunity and certain preventive measures. What is the kind of consideration we should give to those messages for those who are talking about it, being a frontline worker yourself?
I wouldn't want us to, repackage those messages by talking about you need to build your immunity, because the moment you say that, they'll start using all sorts of things. Because I've been able to engage with some of them, and many of them will tell you that I've taken that goal, my immunity is okay, and so on. As I've said earlier, it should be a kind of bottom-top approach. Let's work with all the relevant associations. I'm just talking. Let's take Lagos as an example. Association of Mechanic, Association of all those artisans. Let's work with them so that through them we can get access to some of these people. And as I've said, I grew up to know about national orientation agencies where they use their megaphone, going from one community to the other. I think we need to step that approach, because how many people listen to channel or watch channel in a day, or NTA? So some of them don't even know about this thing. So I think we need to go to the grassroots and talk to some of these people. And as I've said, behavioral change is an issue. We may not actually achieve remarkably to that level we expected. But what we can do more is, as I've said, if number of cases continue to rise, the government has no option than to lock down. But what we need to do is to balance the economy with whatever measure we intend to take. But as it is now, I don't think lockdown is something that I think government should be looking at lockdown at this moment if the number of cases continue to rise. Because
Get to that part. What I did ask is that, for instance, we know the challenge we have with health capacity, the health sector in this country. It's a principle of first aid that I was referring to. When there's a critical solution, people have to first aid before you get to certain places. So is it that that principle does not apply in this case, or what?
It applies. Another thing is that we have to look at the epidemiology of that disease. About 70 to 80% of people are asymptomatic, or they're in their pre-symptomatic stage. So some people have COVID and recover without knowing that they're infected with COVID-19. So that is another challenge we're having. Those people that you are seeing on oxygen are those the fewer percentage, about 16% or we maybe 1% of them may have may develop to critical stage. And those are the people who see that require oxygen. Because a large chunk of the population that got infected, recover without knowing is another reason why some people just assume that COVID does not exist. Some have had it and they recovered it and they didn't know. So that may have also be another reason why some people don't comply. And another factor is the fact that because people are not seeing people on the street dying, unlike what is happening in Europe, and so people feel that, just like what Ali Baba said, that because we have a lot of that thing Thomases who believe that until they see it happen to themselves before they believe in some of these things. So those are some of the other challenges. But we will not, government should not get tired. We are supposed to still continue reinforcing all these messages. But what I just said earlier, it should not be at the upper level. We have to go down to the grassroots, engage all the relevant opinion leaders, our religious homes, our banking private sector, all the relevant associations this time around. We need to, so that let them see, they talk to them so that they can talk to their people. If at the end we are not seeing something remarkable, I think government may decide to take whatever action.
On that, Dr. Ganiu, let me take it back to Alibaba. He mentioned something that, it was when he was out of his area of domicile. Now, you have also seen videos, Ali, of people in Lagos, people at NIMSI centers all over Nigeria. You have seen videos of people at the various beaches during the Yuletide, and I'm very sure, just as you have said, people in the various villages and all of that, just going around like nothing is missing and nothing is broken. Do you think they get the message? I'm asking this based on the fact that you said no one can say they are not aware of COVID-19, but anyone who is not taking precautions now is because of their stupidity. Do you think that they are getting the right message as to the extent or the seriousness of what we're talking about here?
One other thing that you have to even take is believability of information from government is at the lowest ebb right now, especially with the cases of the palliatives that were hidden when people were hungry and all of that. So, and government has not really been in the good books of believability for people. Then to crown it all, in the face of this second wave, you are telling people to do national identification registration, and people are going and packing themselves in places. The number of people that are going to catch COVID or become victims of this COVID from going to register will be higher than, it will generally be like people that went to the beach or people who threw a party. So you can't on one hand be saying COVID is real, social distance, and you are saying, you all have to go and queue and do that. And the way we can technologically deal with these things, the information technology has gotten to the point that we really do not need to go to a particular point to go and verify our numbers. We don't. And the other thing is, because we have a society, a government that should wake up and is not, let's not just perform a census and do biometrics and let everybody have it. But the thing is, it is not now that you have a pandemic that you should insist on that kind of thing. Let pandemic be over. Whatever you are waiting for can be done later. Whatever the purpose that you want to do can be done later. But we are now beginning to see that the purpose is that they want to get access to unclaimed dividends and all those ones. Okay, fine. But what I'm just trying to say is that it is important that people are considered first. When you now start saying people should go register for NIM, it means that you are endangering the people. It's like inviting them to a beach to come and party. If you are closing down centers because you don't want people to be affected and infected, but you are opening your centers for people to come and register, it's the same thing. I think government's dissemination of information is important because it helps believability. And government is not helping. And government needs to begin to take care of it. But you see, if all these doctors go on strike now, this COVID we are talking about will be out of hand. If the doctors decide to go on strike now, they've tried. Well, the Yaba Center that I went to, I saw all the doctors and nurses working hard to make sure with very minimum protection. Face mask and hand gloves does not. A doctor that is going to be moving from one patient to another shouldn't be like that. But you see, that is how these doctors are, and they are working. But do you know that if it is furniture allowance, they will pass it that same day. If it is furniture that these people need, they will pass it that same day. But these doctors that are putting their life in the front line to treat these cases, government is not doing anything. So the attitude of government is also helping to fuel the stories that COVID is not real. Because if COVID is real, you won't be talking about people going to do registration for NIM.
Government, most of the time we focus on the federal government, and meanwhile the federal government through the PTF COVID-19 would say a lot of responsibilities is on the states, just as you have also highlighted now. But another question that will come out here from all of this is, could people prefer to stay away from the isolation center so as to avoid stigmatization? Do you think that's a factor?
It's a factor. It's a factor. I don't know what is wrong with us. If presidents of countries are testing positive for COVID, if celebrities, if billionaires, if notable people in the society are testing and dying of COVID, what is it? It is not gonorrhea. It is not. It is not some sexually transmitted disease. It's a virus. And it's going about. There's nothing to be ashamed of. When I did my video and posted it, a lot of people were telling me, "Oh, you are bold, though, that you came out with it." Why should I be afraid that I had COVID and I survived it? You spread the word, and then the other people that are now saying, "Oh, for you to have come out to say that you had COVID, it means that you were paid." Now they go pay you to say you get disease. They will pay anybody when they talk and will pay. And any governor, and I'm not even any governor that says there is no COVID is a fool. Any governor that says there's no COVID or anybody that says there's no COVID is a big fool. You see, let me tell you, these are the people that are part of the problems. People that are part of the problems across the world. 300,000 people have died in America. Abba Kyari died. You think if there's no COVID, government will let Abba Kyari die? It's somebody that's as important to the government. So just to tell you that people who do not believe are the ones that are putting themselves in danger. You can say you don't believe, but so just stay away from people who believe. Stay away from people who believe. Just stay away. Don't come and use your reggae to spoil our blues.
All right, Dr. Ganyu, I hope the furniture allowance bit will not make doctors start thinking about another strike. So please, we hope everybody will still keep helping out. So ignore that furniture allowance part and keep doing the good job that the doctors are doing. All right, so we thank you, Dr. Jamiu Ganyu, public health physician, and Alibaba, thank you as well. And what a day.
COVID survival. COVID survival.